Awesome. Well, thank you so much for being here. I know we'll have some people kind of coming in over the next few minutes, but I just wanted to welcome everyone and say thank you so much. We're really excited about this series. This is our fourth event in this series, and it's been really, really engaging and enlightening for me, especially. My name is Amber, and I'm the director of Lausanne Learning. We are the educational nonprofit at Lausanne Collegiate School here in Memphis. I'm super excited to have everyone here. I'm going to be in the chat the entire time, kind of moderating. If you have questions, we'll also have a Q&A at the end. So feel free to pop in there at any time. I can also help you with tech issues, hopefully, if you pop in. So please introduce yourself. Let me know if you have any questions, comments, or need any assistance. Just some housekeeping. This is being recorded, so if you don't want to appear on the recording, that's totally fine. Just keep your camera off. You've entered muted. That's not because we don't love your lovely voices. It's just to cut down on background noise. We'll have the recording out to you later this week. And if we have any issues with the Zoom, which we haven't yet this year, so we're doing okay. But if we have any issues with the Zoom, I'll just close this and send you a new link. So don't panic. I'll be here the whole time. I'm going to kick it over to Greg Graber, who is our Director of Social Emotional Learning at Lausanne, to introduce our speakers tonight. Greg, I'll hand it to you.
Amber, thank you everybody for being here. I'm really excited about tonight's session. We were talking a little bit a couple of minutes ago about compassion fatigue, Zoom fatigue, everything that's going on. And I am delighted that we couldn't find a better expert and speaker than Dr. Danielle Jackson. I think her best accolade is she's a Lausanne mom, but kind of above and beyond that, she is a social worker, and she teaches on the university level, and we are delighted to have her. So thank you, Danielle. Thank you everybody for being here.
Well, thank you. I appreciate it, Amber and Greg. So I want to say thank you guys for really hosting, this series. I, was just saying to someone earlier how fortunate I feel in being able to not only participate, on the panel, but like you said, to be a Lausanne mom. So thanks everybody for joining, and I hope that this really is very informal, and I want to have really good discussion about it, and hopefully you guys will have some takeaway from the subject matter. So I'll just talk a little bit about really briefly, because I don't like to talk about me a whole lot, but just so you can have some background. Again, I'm Danielle Jackson. I am a social worker / licensed professional counselor in the Memphis area. I've been in the field for a while now, I don't know, several years. And, over time, I've come to really come about this topic kind of happenstance. And what I mean by that is, so I attended a workshop several years ago. I don't know if everybody's familiar with this topic, compassion fatigue, but it's really kind of it's a hidden gem, so to speak. So I think it's people think about it and they say, well, I'm fatigued from being compassionate, but it's so much more than just that. So, tonight I'll talk a little bit about, what is compassion fatigue? What is it not? How does it, apply maybe to you guys, or what are some symptoms and signs? And then we'll watch a little bit of a video. So I came across a video that I thought was very, important in being able to kind of sum up what, compassion fatigue is. And then we'll talk about self-care. I think with, COVID and all the things that many people have experienced, our kids have experienced. Like I said, I'm a mom of a teenager who attends Lausanne, and it's been tough. And so I think this is a very important topic. So, I will go ahead and get started. And certainly if you guys have questions, please, stop. If you have a question along the way, I don't mind answering that, along the way. So again, I'll go ahead and get started. So I wanted to read a little bit of a quote from the founder of compassion fatigue. So I mentioned a few minutes ago that, I stumbled across this topic. I will say that I've been in the field of social services for really about 20 years or so. And one of my first introductions to really counseling and therapy and those kinds of things, right out of college, I kind of started to work with kids who were traumatized really early. And along the way, I would run into other people, whether it's work or people who've had experiences with trauma. And, there were certain things that I found that were common, right? So common, experiences with trauma. And being a helping professional myself, there were times when I as well had, I could relate to these people telling me the stories about trauma. So trauma compassion fatigue has been around since the 90s, right? So it was really started and coined by a gentleman by the name of Charles Foley. And I'll read you a quote from him specifically because I think it really summarizes what compassion fatigue is. So here's something that he wrote in 1995. We have not been directly exposed to the trauma scene, but we hear the story told with such intensity, or we hear similar stories so often, or we have the gift and the curse of extreme empathy, and we suffer. We feel the feelings of our clients. We experience their fears. We dream their dreams. Eventually, we lose a certain spark of optimism, humor, and hope. We tire. We are not sick, but we aren't ourselves. I think that really speaks to, you know, um, what compassion fatigue is. And as I mentioned with COVID, it is his, I think this has really come on the horizon more now than any other time. People are having just a load of experiences. But before we talk about, the signs, symptoms, what compassion fatigue is, I'd like to talk about really what it isn't, right? Because I think it is confusing for people. As I mentioned, it's not just being fatigued about compassion. So what compassion fatigue is not, it's not the same as burnout, right? So I really want to stress that. People say, I'm fatigued. I may have compassion fatigue. I'm burned out. It's a little bit different than burnout. It's not a mental health diagnosis, right? So you can't go into, a therapist's office and talk and they diagnose you with, compassion fatigue. It is sort of a stress or similar to like a stress disorder, but it's not specifically, right? So you can't get diagnosed with compassion fatigue. And then the most important thing, and one of the reasons I chose this topic tonight, is that it is not uncommon. It is not uncommon. It is very common. I think compassion fatigue really touches many people, people's lives, myself, people I work with. And it's not just, it is directed for caregivers, but it's not just for caregivers, right? So it is for people who have experience with caregivers. So really it's multitude of, um, it really touches a wide array of areas. So let's talk about what burnout is. So burnout, the difference between burnout and compassion fatigue is that burnout often happens over a period of time. Maybe it's work related or maybe it's something else, right? So compassion fatigue is specifically, and it's also known as a secondary trauma, or they call it vicarious trauma. It is a different form of stress in which people kind of take on the suffering and symptoms of other people who have been traumatized, in short, is what it is. So I want to give you a few signs and symptoms about compassion fatigue, some things that, to look for, or maybe you're experiencing or other people have experienced. One of those things is physical and mental fatigue, right? So you're wiped out, every day, all day. Anger and irritability is another, symptom. Negative and unhealthy coping behaviors. So people who, not everyone naturally, right? So people who use or abuse drugs or, maybe they're drinking a little too much. Um, those are sometimes some signs and symptoms. Less enjoyment and satisfaction with work. So I talked a little bit about, burnout. This is it also can relate, and this is particular for people in helping professions. They don't enjoy it as much. So increased absenteeism, so calling into work, not showing up, um, you know uh, leaving early, coming late, those kinds of things. Blaming others for their suffering. This is really one that is very specific, I think, to compassion fatigue. And by that, I mean you won't necessarily see that in a burnout situation. Burnout, you don't think of suffering. You think of maybe you're tired and it's too much, but there's a different level when you're dealing with people who have been traumatized. Another sign or symptom is insomnia and an inability to sleep. Maybe you're waking up early, staying up late, not sleeping through the night, waking up often, those kinds of things. Increased nightmares. That's another very common. You may not have experienced the trauma directly, but you are experiencing that experience with someone who has. So you're having nightmares throughout the night, feeling hopeless or powerless, not knowing what to do. What are some things you can do? Um, and we'll talk about that a little later. Feeling burdened by the suffering of others, and that's a huge one. So this is really why I wanted to have this discussion tonight, is feeling burdened by the suffering of others. People are carrying a really heavy load, I think, these days, and it is again very tough. And I wanted to talk about a subject matter that really touches us all in various different ways. And another one is isolation or loss of morale. So not feeling like you really are a part of the group at large, right? So those are just a few areas. So how does this really apply to children? It's very similar. And so that is why, as someone, dealing with social emotional learning, I think, you know, for children, it's very similar, but it's going to show up in a few different ways. And some of those ways may be they're experiencing children guilt, right? So they have guilt for not necessarily anything they've done. Um, they're fearful. Few other things, poor boundaries. Having poor boundaries are signs and symptoms in children who are experiencing stress. Feeling anxious, avoidance, and not necessarily able to listen, an inability to listen. So if you notice that you have a child who normally is on point, maybe they, are very organized and, are able to get things done timely, they stick to a schedule, and then suddenly you're having a conversation with them and now they're distracted all the time. Sometimes it's just a matter of stress, and so these are some ways that children experience their stress. Also, chronic exhaustion, um, loss of creativity. I think that's huge. Definitely, for sure. I've worked with children for a really long time, half probably of my career with children and half with adults. And I will say that loss of creativity is one that I saw very common. Just not having the ability to think outside of the box. Hypervigilance, always kind of the startle reflex, having, being kind of jumpy. And so those are just a few things that children have, that's how they relate to the world when they're stressed. So I'd like to go ahead and see if I can show this video. I think the video really is going to sum it up. It is a little bit lengthy, I will say, It's about 15 to 17 minutes long. And so this video is from the founder of what's called the Compassion Fatigue Awareness Project. It's a lady who really was passionate about various different, things related to compassion fatigue. As I mentioned a bit ago, it's been around since the 90s. I think it's just really coming on the scene within the last maybe 10 years or so. And she gives this story and kind of summarizes some of the things that I've already mentioned in terms of signs and symptoms, but I really couldn't, put it any better, I think. And it's just really great in how she tells the story. And I'd like to play that if I can. Let's see.
And Danielle, can I just pop in real quick? Tasha had a
Sure.
question in the
Oh,
chat
sure.
about
Sure.
what's meant by poor boundaries. Can you
Oh,
expand
that's
on
a
that a little
great
bit?
question.
Yeah.
Sure. So, boundaries in children, that I appreciate the question. So that's a very it's going to depend upon the child, and every child is a little different. But what I mean by poor boundaries, for example, let's just say, as I mentioned a little bit ago, you have a child who is pretty much, you can redirect them, for example, and maybe you give a directive or give a suggestion, and they proceed on. But you've noticed where over time, um, they're not mindful, right? So not mindful of your space, or the directive that you've given. Um, they have ignored that, so things such as that, kind of not really being respectful of your time and your space, but maybe before they were able to maintain those things. Now, let me just say, sometimes it's age appropriate, right? So the younger they are, the less boundaries they're going to naturally have. So if you have a younger child, 3 or 4, for example, it's going to be different than if it's a teenager, for example. Did that answer the question? I hope it did.
She said, thank you and yes.
Okay, great.
Yeah.
Awesome.
Thank you,
Okay,
Tasha. I appreciate the
yeah,
question.
thank you. And anybody else who has questions, please ask along the way, because sometimes, again, I do this for a living, so I forget, I have to kind of explain, what some of those things are. Okay. All right. Let's see if we can. Are you guys able to see my screen?
I can see it.
Yes, I can.
Okay, let me get this. Oh, can you hear? No.
I can't hear anything from the video yet.
Yeah, can't hear anything yet.
Okay, hold on.
I can hear it.
If I can get it full screen.
Hello, and thank you for being here.
Uh-oh.
I'm very pleased to be here. I'm going to talk to you about compassion fatigue and caregiving. If you have been a caregiver, or you are now in the throes of caregiving, or you will be called to caregiving, I hope this information will be helpful
Oh, I'm trying to get it full
and
screen.
useful to you now and in the future. Compassion fatigue and
Let's see if I can get that full screen. Hold on. There you go.
passion fatigue and caregiving, navigating the road to wellness. During the Vietnam War, a young psychologist and first responder named Charles Figley noticed something very unusual was happening. As the wounded warriors were coming off the battlefield and sharing their stories of horror and trauma that they were experiencing on the battlefield, he noticed something funny was happening. It was indeed changing him. And he didn't understand that because he knew as a professional how to protect himself. He started to feel less safe. He started to question his values and morals, and his whole quality of life just started to plummet. It was then he had an aha moment, and he said to himself, something is happening here. I am taking on the pain and suffering of the wounded warriors, and I am making it my own. In a sense, what he was doing was he was experiencing a secondary traumatic stress syndrome. This became his life's work, and in 1995, he coined the phrase compassion fatigue. I first learned about compassion fatigue 20 years ago. I was a single mom with 3 kids. I worked 2 jobs. During the day, I was an editor with the college textbook publishing firm, and at night, I worked as a correspondent for the San Jose Mercury News. When my last one went off to college, my daughter Elizabeth, my youngest, I said to myself, it's time to do something for me, something that I want to do. I've always been a lifelong caregiver for animals. I've always loved animals. I realized that society has a flagrant disregard for animals, and I wanted to change that. I was going to save every animal that came my way. I also wanted to get into training and development. So I enrolled in a year-long certification course at UC Santa Cruz. And when I got my certification, I started to look for a job. Well, this was about 1999, and at that time, we found jobs on Craigslist. So I went onto Craigslist, and lo and behold, there it was. Training and Development Manager, Humane Society, Silicon Valley. It was my job. So I went and applied, and several interviews later, I got the job. 2 weeks into the job, the executive director came to me and said, I'd like you to do a compassion fatigue training for the entire shelter. I said, sure, I'd be happy to do that. I was a new employee. I wanted to impress her. I wanted to do a good job. But what I realized is I didn't know anything about that. I had never heard that term, compassion fatigue. So I went up to my office and I Googled it. What came up was the academic writing of Dr. Charles Figley and the professional quality of life self-test, that's the work of Dr. Beth Hudnall-Stamm, who at that time was the director of the Institute for Rural Health at Idaho State University. Well, much to my surprise, after reading all the material and taking the professional quality of life test, I realized that I suffered from very, very, very high levels of compassion fatigue. It had probably destroyed my quality of life for many, many years. This started me on a journey to learn more about this, and in the meantime, I started the Compassion Fatigue Awareness Project, and it has brought me on a road to wellness that has brought me here today. In the 4th century, we have this wonderful comment. This is the 4th century, this man said this. Life is not merely to be alive, but to be well. And this is the core of my teaching, of my education, is to try to teach caregivers that they can't just go through the whole process of caregiving just every day trying to do the best they can. They actually had to be well. And what does that mean? We're integrated human beings. We're talking about body, mind, and spirit, teaching them to be self-compassionate caregivers every day to do something for themselves. So why do some people get compassion fatigue and some people don't? What are the symptoms? How do we recognize it in ourselves and in others? Dr. Figley says compassion fatigue is a state experienced by those helping people or animals in distress. It is an extreme state of tension and preoccupation with the suffering of those being helped to the degree that it can create a secondary traumatic stress for the caregiver. So what are the symptoms? How do we recognize it? It's a rough road. Believe me, I know. I've been there. The first thing is we notice we want to isolate. Why do we want to isolate? Because everyone is asking of something from us, and we don't have anything left to give. We're fairly depleted. The rhythm of a healthy caregiver is fill up, empty out, fill up, empty out, fill up, empty out, every single day. Well, if we deplete, you can see what happens. We get this set of symptoms. And remember, this is only a set of symptoms. It's not a disease. It is fixable, and I'm going to show you how we can do this. So isolation, we want to isolate. We don't want anyone else to bother us. Emotional outbursts, where does that come from? It comes from the fact that in our early childhood and our formative years, we did not learn good coping skills, and we learned to just push down everything in order to deal with our lives if indeed there was trauma and pain and suffering in our early lives. So we push it down and we push it down and we push it down until sometimes the human body says, I've had enough of you, and it comes out as an emotional outburst. Physical ailments, what are these? You go to the doctor, you say, Doctor, I feel just terrible. And I can't get well. I don't know what's wrong with me. What is it? It's the headache that won't go away. It's that scratchy throat that's always there. It's that pain in the back of the neck. It's the shoulders that are so worn out because we're carrying such a heavy load. It's that lower backache that keeps us from living a full, happy quality of life because we can't do what we want to do. It's the gastrointestinal problems. And what are those? Those are the stress points of the human body. The body is saying to us, stop, stop. You're hurting me. But we don't listen because we've got to keep going and going and going. A them versus us mentality. And this is just the fact that we always feel we're other directed and everything is out there. The problems, the challenges, the answers are all out there. So we set up a them versus us. When in reality, all of our answers are inside. Healing is an inside job. From the inside out, not from the outside in. Substance abuse. We all know, we read it every day, we know this is going on in our society. Americans are self-medicating, but we're not self-medicating with good food and exercise and healthy relationships. No, we're reaching for the chocolate and the overeating and the gambling and the pornography, the drug abuse, the tobacco. We all know we do it. There's no shame in it, we all do it. Sadness and apathy. And this is that veil of sadness that's over us all the time. I know I suffered from that terribly. I would go to parties or events or even at work and everybody was happy, and I never quite understood why I didn't have those same things going on in my life. So sadness and apathy because we're not living that full quality of life, which is our full human potential. Flashbacks and reoccurring nightmares. When this happens to you, the chances are very good that you probably need some professional help with a mental health professional. The one thing I can say is make sure that your therapist, psychologist, psychiatrist knows what compassion fatigue is. Oftentimes they recommend go to Hawaii for a couple of weeks, make you feel much better. Oh, it will for 2 weeks, but then you'll come back and you'll fall right back in to the crevice of compassion fatigue. So, what causes it? Why do some of us get it? Some of us don't. Well, as most things, it begins in early childhood, these patterns. The pattern of other directedness. Somewhere along the line, we learned that it's more important to take care of others before we take care of ourselves. And when we try to take care of ourselves, we have feelings of shame and self-centeredness and selfishness. And we have to overcome this. If indeed we don't fill ourselves up, we have nothing left to give others. It's that simple. A lack of strong personal boundaries. If we suffer from the effects of compassion fatigue, our personal boundaries are way out here. We let everything and everyone into our lives. And oftentimes it's hurtful and it doesn't help us at all. The journey to wellness is bringing in those personal boundaries. We decide what we will and won't allow in our lives. And this is very difficult. It sounds simple, but I can tell you it is the most difficult thing you'll ever do. Learning to become from other-directed to self-directed is the most difficult journey, but it is worth every minute of the work. Unresolved past pain and trauma that lives within us. We keep pushing it down, but it's in there, and it's going to come out. We have to learn ways in which to let go of the trauma that we experience. We can do it with rituals, we can do it all different ways, because what doesn't move through us defines us. Overdeveloped sense of responsibility, and again, this comes from that early childhood. There might have been drug abuse or alcoholism or physical abuse in the family. And as little people, we watched this going on, and we became very responsible for everything. And we carried these patterns into childhood, and we feel like we owe the whole world. We're responsible for everything. And an impulse to rescue anyone in need. where I saw this, and I continue to see it as I travel the country, is in animal welfare work. When I was at the shelter as a training and development manager, the young people often came to me and said, I have a problem, maybe you can help me. And I said, what is it? Well, I've adopted 6 dogs, 5 cats, 3 guinea pigs, a garter snake, and there was a pot-bellied pig, and I was thinking of taking that home too. And I said, well, what are you going to do about this? And I said, I don't know. I'm in a 1-bedroom apartment with 3 other people. The personal boundaries, if you adopt 1 dog, take home 1 cat, you've done your job. So we tried to shrink down their impulse to rescue anyone in need. And we've all worked with people probably that have done this. So where do we start? How do we start making our lives better? How do we lift our quality of life so that we're happy, healthy human beings? We start with creating a self-care plan. And people say to me all the time, I don't have time for that. I'm too busy. I'm too busy caregiving. I'm too busy doing other things. I don't have time for a self-care plan. And my answer to that is, you need to make time. Get up a half an hour earlier and run or walk or meditate or do yoga. Make that time for yourself. It's absolutely important. So, authentic, sustainable self-care. We need to do what's authentic to us. And this is a road we have to travel as well. We have a world today that is constantly telling us who we are, who we should be with, what school we should go to, what we should eat, what color our hair should be, what color we should wear this fall. All of that is being bombarded on us. And in order to find our true north, we need to spend time with ourselves and figure out who we are and be that authentic person. And it has to be sustainable because, boy, it just keeps coming. You may be caregiving now, and at some point the caregiving will end, but it will happen again. It's just the way life is. We take care of each other. That's what we're about. Empathic discernment. We need to figure out what hurts us. And if something comes at us, a photograph or post on Facebook or something like that, we have to learn when to say, stop, this is hurting me, and stop looking at that. If someone says something hurtful to you, please don't say that to me, you're hurting me. It's okay to do that. Ask for help. Caregivers are not good at asking for help. Strengthen your resiliency. We now know that this is something that isn't genetic. We all have the ability to be more resilient. We need to practice it. Live a balanced life. Fill up, empty out. Fill up, empty out. Embrace spirituality. New studies show that we all need a form of spirituality. It doesn't need to be a traditional form of spirituality. It can be anything you want it to be. We live in Friday Harbor. My gosh, go watch the orcas. There's no higher form of spirituality than watching those beautiful creatures. Be mindful. Mindfulness is a huge thing right now. They're using it in schools. They're using it everywhere. It means being 100% present in what we're doing. And what more beautiful gift can we give others to be 100% present for them? And be grateful. Be grateful that you've been called to caregiving. It's a precious and sacred gift. Leo Buscaglia is, he's now no longer with us, but he once said in this phrase, too often we underestimate the power of a touch, a smile, a kind word, a listening ear, an honest compliment, or the smallest act of caring, all of which have the potential to turn a life around. As caregivers, we have that in our hearts and hands. We have the ability to change the world. We have the ability to change a life. I know this is true because it happened to me. Many, many years ago, when I was going through this and learning all about compassion fatigue, I left the shelter because I was so terribly burnt out. And what did I do? I took the job as director of programs at Ronald McDonald House at Stanford. I traded euthanizing animals for working with dying children and their families. At that point, I was pretty much on all fours, and I thought, if I don't do something for myself, I'm not going to recover from this. So I moved to the coast of California to a little village called Capitola. I rented a small studio apartment about the size of my thumbnail, and I lived on credit cards. I would not recommend that, but sometimes in life we do what we have to do. So every day from my little apartment on Depot Hill, I would walk down into the village, down and around, beautiful ocean there, up around the train trestle, by beautiful, on the right-hand side, beautiful Shadowbrook restaurant, left-hand side, the parking lot for the restaurant, and I would walk a couple more blocks and I would go to the library and I would take out books free of charge. One day, after months and months of doing this ritual, trying to clean out the cobwebs and resolve some past pain and trauma, I walked by the restaurant, and I looked to the left-hand side, and there in the parking lot in the corner was a pedestal about this tall, a wooden pedestal, and on top of it was a wooden hand-carved frog of equal size. This thing was big. I thought, I've never seen that before. They must have just put that there last night. So I walked across the parking lot, and I was in awe of this thing. I walked around it several times and enjoyed looking at the beautiful artwork. And out of the corner of my eye, I could see this man walking toward me. I think he had a straw hat on, but I'm not sure. Anyway, when he got up to me, I said, "Hey, do you know anything about this frog?" I said, "I've been walking here for months and months and months, and I've never noticed it. I think they put it here last night." He said, "Oh, no." He says, "That's an icon. It's a historic icon here in Capitola. He's been sitting there for a lot of years." And I said, "Well, then I guess maybe today it's a sign for me. It's telling me I'm ready to croak." He looked at me and he said, "Oh, my dear, no. It's telling you you're ready to jump." And with that, I looked back at the frog and I turned to thank the man for his kind words, and he was gone. He was gone. I ran to the side of the road. I looked to the left. I looked to the right. I ran to the other side of the road. I looked to the left. I looked to the right. He was gone. Seemingly, he disappeared in thin air. And to this day, I believe he did. But I can tell you that his words changed my life. Shortly after that, I put two and two together. I connected the dots, and I did some wonderful things in my life to help others, which I continue to do today. I know that all these years, and that has been a long time, his words are still with me, because whenever I'm afraid, or I'm nervous, or I'm upset, or I'm frustrated, his words pop into my brain, and it says, "Jump." And I do. And it has made all the difference. Thank you.
Okay, so yeah, I'm glad that I could show that video. Um, I think that, you know, better than any way that I could possibly explain it, it really kind of hit home. So, I wanted to follow up, and hopefully we can open up for, some discussion, um, with just a few things in terms of, self-care and talking about, what that is, or how you can, provide for yourself. I think as a society in general, we're trained to, like she mentioned, to take care of other people. And sometimes you take in so much all the time that you forget you have to, energy travels. You have to get rid of the everything that you take in. So you have to replenish, right? So and so really compassion fatigue really speaks to this. She talks a lot about caregivers. And I think this is caregivers in all forms. For me personally, as a therapist and as a licensed professional counselor, slash, social worker, and even, a teacher of sorts, right? So with students, um, it really, you see it in so many different ways. And we take on so many other, so many burdens of other people that we forget that we're people too, sometimes. And so then your mom, like I'm mom, right? So, I can't stop being mom, as well as trying to help other people who have been, who have experienced trauma. So I just want to just spend a few minutes talking about different ways of self-care. She kind of touched on that, but that's important really as, we come to maybe the question and answer portion, because I think more than anything else, that's what this is about, right? Is this learning to practice, give our kids the tools to be able to, um, you know, know what to do, uh, when they are experiencing something similar in ourselves as well. So the real term of, the opposite of compassion fatigue is going to be compassion resilience. I believe, if I'm not mistaken, that was one of the topics before in this series that talked about resilience. And so a few things just to, to kind of bring it home of practicing self-care as a caregiver. One of the things that I think is really important is to kind of reframe how you look at situations, right? And so what does that mean? So that means, it's kind of the glass is half empty, half full, right? You can look at it either way, but the way that you look at it will depend upon kind of how maybe your day goes. If it's half empty, then you're starting in the negative. If it's half full, then you're kind of starting in the positive. So just take a moment to look at a situation and kind of reframe how you see it. The other one is, and I think this is a very important one, which is manage your own reactions and expectations. I think that's huge because I think sometimes and I am guilty of this myself as a parent, you have expectations of your kids or your spouse or who significant other, or maybe it's a coworker of, something you expect, but a lot of times, we don't always follow the advice or you don't follow the mantra of what we expect, right? So you have to manage and be real about what people can give at what time, especially during this time as we transition, hopefully out of, COVID and find our way back. I think this is huge. Understanding that people are in different places. And what I mean by that is not physically, I mean mentally, emotionally, spiritually. People are in all different places. So you have to kind of manage your reactions to that and learn how to, it's not always about them, but what you do differently, right? So another one is staying committed to finding meaning that sustains you. You have to find what's important for you. What's important for you may be different than what's important for someone else, but stay true to what's important to you. And that's not being selfish, right? That is learning to take care of yourself. And you can't give someone what you don't have. And that's something that I really have learned, and I repeat often, in the practice of therapy and just in conversations. I have to remind people and myself sometimes, that you can't give people what you don't have. The other is sleep well, eat well, take care of your body. She talked a lot about the body. That is huge. I mean, I am guilty. I will tell you I don't love chocolate, but I'll give an example. I don't know. I love sweets. I'm guilty of that, absorbing somebody else's energy, and maybe, it's been hectic. And so I want to grab that comfort, right? Food, which is not necessarily great for my body. So, eat and sleep well. Another thing is emotions are contagious and energy travels, right? Bring and spread joy to others. That is, I say that to people and, we don't always think about how much energy travels. Have you ever been in a room with someone and, maybe you're having a great day and they're really angry, and then you leave and then you find yourself angry and you have no idea why? It's happened to me, like, a number of times. Well, energy absolutely travels. So, having the opposite effect is huge as well. So if you're really, having a great day, it's contagious. It really is. So spreading joy is huge. Connecting with people. I think this has been the hardest. We were talking a little bit before this started about, Zoom and fatigue and, trying to, get back to kind of what we know. But I will say, the isolation has been huge for people. And we're trying to find ways of connecting. I always say, we're not meant to be on an island, right, by ourselves. It's just not. We're people. We're humans. We like to connect with people. So that's one way. And recognize that being difficult maybe someone else's best coping skill. If that's, you know, everybody doesn't have the same set of skill sets or training or background. And so I think it's important. How does that affect you and your self care? Well, it goes back to managing your expectations. It doesn't mean that it's okay. It's just understanding that everybody is kind of in a different place. And so if you manage your expectations, then you're taking care of your emotional needs, right? Um, and then the other, and one of the last things is consider radical kindness. I don't know if anybody on here remembers, but I've actually had this happen, around holiday times where I've been in line maybe for a coffee or something, and the person ahead of me paid right for my order without knowing what I was ordering. They don't know me. Um, I paid it forward. But that really sets up kind of a experience for your day. So consider practicing radical kindness, being kind for no other reason than the next person is just deserving of it. And those things also spread. So those are just a few things that, I wanted to add in terms of self-care, because it all comes back. It's really full circle. What you give comes back to you, tenfold. So um yeah, so I'd like to, just take a moment to see what you guys thought about the video, or if you have questions, or open it up for discussion. I'm kind of open to that. So hopefully you were able to get the idea of what compassion fatigue is. I think it is confusing for some people, but hopefully now that it's a secondary trauma of sorts. It's a stress. It's kind of like a stress disorder. So yeah, thoughts, questions?
So Danielle, the first time I ever, thank you, by the way, that was awesome.
You're welcome.
The first time I heard of this was a couple of years ago. I gave a spill on mindfulness at Le Bonheur Children's Hospital, and
Okay.
someone mentioned to me. I had no idea what it was, but now I always kind of picture when someone says this, the airplane metaphor, where if the oxygen mask falls down,
Yeah.
you take it first, because you're no good to anyone else unless you take care of yourself first, kind of thing, right?
That's right. Yep. That is absolutely right. And I think that was even a hard concept for people to grasp, right? When I remember kind of, I'm, old enough to remember that when it kind of started, they started kind of changing that, you know, that lesson of, put your mask on first, and then, take care of your child. And people will go, well, how is that possible? Why is that? But yeah, no, it's exactly right. And I say all the time, you can't give people what you don't have. You can't. And so if you don't take care of you, then you can't take care of anybody else. And
Yeah, I
that's
agree. And I think there's a misconception in our culture, maybe more so for our parents' generation, that self-care is like indulgent or
Mhm.
selfish,
Yes, it is. It
right?
is.
Yeah.
It is absolutely childhood. I definitely think that, and like I said, this term compassion fatigue was around in the 90s. Um, but again, I didn't learn about it either, until maybe 10 years ago or so. But I definitely think, the hard work and putting in the effort, and maybe some people were reared in siblings, and you take care of each one behind you, that kind of concept. But you forget. I know my parent is guilty of not understanding self-care, so I
Mhm.
have to kind of reiterate that, right? So it's definitely generational for sure.
Mhm. Exactly.
Definitely.
Thank you.
Yes, you're welcome. Questions? Anybody? Thoughts?
So I was just going to kind of build off that last thought of it being generational. My mom is a caregiver. Like, she loves taking care of people. She is less good at taking care of herself.
Mhm.
And one thing that has been really hard generationally for us is for me to say, you need to take care of yourself too, without it sounding, I guess, critical. So, what kind of I know, like, you can't control other people, but I guess one thing that I struggle with is seeing people I care about struggling as caregivers
Mm,
and struggling with compassion fatigue. Do you have any
right.
kind of thoughts on that or ideas about how to make my mom realize I'm not being mean? I just want her to take care of herself.
Yeah, so I think, and I think it's particularly hard for parents, because you may be an adult, but they're going to always be your parent, right? So they always want to do and give. And with that generational is, I think it's twofold. One is understanding that it is generational to some extent. Um, and so there's a point where it's okay for you to want that for her, but you have to also accept that she may not know what that looks like. And so that's you wrestling with, because when you know better, you do better. But sometimes, knowing better and doing better is harder for, folks who are in a different age bracket. So I think it's partly you knowing when and when not to. So when to accept that, that may be as good as it's going to get. But the other piece is you can give her little tidbits, right? So along the way. So it can, and this is what I've had to do with mine. When she's wanting to give, my mom is wanting to give, and give and give and give. And I really, myself, it may not work for everybody, but I'll say, I'll say to her, I need you to stop for just a second and hear what I'm about to say. And understand that I appreciate everything you do. So you're letting, them know that you're appreciative, but I need you to go and do for me, do for yourself what you're going to do for me. Right. So maybe that is, you're telling me to rest. You're telling me to, take care of yourself. Well, what does that look like? Well, you can't tell me if you're not willing to do it. And that's kind of a way that that's a workaround. And so over time, she's been able to hear that enough times. So you can't do for me what you're not willing to do for yourself. And you can't tell me if you're not willing to do it. So it's kind of like a team effort, right? So that's one of the things that's worked for me is like we kind of team together this whole concept of self-care. And sometimes it may be something simple. It may be, maybe shopping together, or we're going to the nail salon together, or, and sometimes I pamper her um on the reverse, right? And I have a parent who's not doesn't take giving, doesn't know how to take, giving. Very she wants to give rather than receive. So it's been tough for sure. But I think it's, you have to accept that that may be as good as it gets too, right? You want the best for, but, generationally, that's what she's rooted in. So I think it's a balance act for sure.
Awesome. Yeah, I think it's hard too when your parent who is like that says, "Oh, you
Mhm.
do too much. You don't take care of yourself." And I'm like,
Oh
"What?
yeah.
You do that too?"
Right, exactly,
Yeah.
exactly. But again, so and I get that. I absolutely get that. And I say, well, look where I kind of learned it from. So why don't we do something the opposite of that?
Mhm.
If you do this, I'll do that too. And so it kind of gives like we're working together to do the opposite of what we've learned. And so I think that way it's been kind of successful.
Awesome. Thank you.
Yeah. Any other questions? Do we have questions or thoughts? I hope this was helpful. I really do. I know that it's not um, always an easy subject when we're talking about trauma and secondary trauma. So
I wanted to share a thought,
sure.
and it's basically kind of really inside the whole experience of joining tonight to listen is part of reminding myself that if I'm not too wrapped up in the things that are daily life, it's not overwhelming. It's just there's lots to do. Um, I can notice, I can listen, I can make time for myself. And above all, I can see and hear that there is information circulating that's very helpful and that help and like tonight, like listening to you, like sharing in meetings in Lausanne Learning and the SEL. There are opportunities to almost refresh because of listening to other people's perspectives, professional perspectives, and just personal perspectives, which it's almost like watering a plant. So with the incoming, there's a little bit of relief that, yeah, I'm not the only person who really gets wrapped up in whatever, getting it done, doing it right, saving the world, and we need to save the world. There's no doubt we need to, but we can't be exhausted, or I can't do it if I'm going to be exhausted. So yeah, no, it's. I just thank you so much for your perspective, personal and professional, on this. It's
Oh, you're welcome. You're welcome. I mean, I think we're more common than we are different a lot of times. And so many people deal with these things, and it's unspoken, right? Nobody wants to speak about it. It's just ingrained. And you say to someone, "How's your day?" and they go, "Okay," but maybe they're not really. It's just changing the way that we relate. And I think that over time, if we continue to do that, then we'll be much better for it, for sure. We've got to speak to that. So thank you.
Thank you. Turn off in a minute.
Yeah, I think that idea of we're all, I think what we were kind of talking before, we're all kind of having a little compassion fatigue. I think COVID has changed a lot of things. Like, I know I definitely think when people walk by, they're like, "Oh, how are you?" I'm like, I mean, I'm gonna say fine because that's like what you do, but like actually I'm very stressed and I'm anxious and I'm lonely and you have all these emotions. And I think that I agree. I think talking about compassion fatigue and also just kind of how we feel is maybe helping us move away from just like, "Oh, I'm great," because we're
Right. Yeah.
not
And
every day.
yeah. Yeah. And I've learned, I actually, sometimes I shock people because they'll ask me that, and maybe I'm really tired, and I'll say I'm tired, and they'll go, "Oh." And so then that starts a dialogue, right? So, that's the therapist in me. I see a couple of people laughing, but really that's the therapist in me. And so the reason though that I do that is because I'm doing a disservice to myself, really, right? When you're not okay. And so I think we get really busy, but we forget we're people. We're people who have really big hearts and want to give to other people, and which is great. But sometimes we forget ourselves in the process, So I encourage people to tell, if someone says, "How was your day?" And if it's great, it's great. If it's not, just say that. Yeah.
It's funny. Mark Brackett, in his book Permission to Feel, says that. We always ask people, there's sort of the perfunctory or the rhetorical, "How are you?" And we don't really expect the real response, right? But
Right. We don't.
we
Right.
should.
We
I
should.
love that. I love that you do that.
Yeah,
Great.
we should. I mean, because it starts with us.
Yeah.
Yeah.
No
And
doubt.
that's self-care. That's self-care.
Thank you so much for being here.
You're welcome. Thank you for having me. I
That was
hope,
awesome.
yeah, I hope that it was very informative, and some people got pretty good tools to take with them. So
Without a doubt. So.
Yeah.
awesome.
I did for sure. Yeah. Thank you so much for being here. I've heard those words together, compassion fatigue, but I didn't really understand like what that meant. So I feel like I learned a lot academically and kind of to deal with life too. So thank you.
Good. You're welcome.
Yeah.
You're welcome. Thank you for having me, for sure.
Yeah. Does anybody have any other questions? All right. I don't see any in the chat. So I want to be respectful of everyone's time. So Danielle, thank you so much for being here. I will have Dr. Jackson's talk up probably tomorrow, but I will send everyone a link to the website that it's on. I'll also link that TED Talk in. I know Patricia Smith's website, she does a lot of stuff too, and she's written a couple books, I think.
Yes.
Yeah, so I can link to all that as well, so you'll have it all in one place. So thank you so much, everyone, for being here. We have our final SEL speaker series event of the school year in May. So I'll send you the information on that, but it's going to be Dr. Colby Taylor talking about mindfulness and your body and kind of how SEL and physical well-being work together. So it's going to be really exciting. Danielle, thank you so much for being here. Thank you, everyone, and have a wonderful evening.